Hey everyone, and welcome to The Explainer. Today we're diving headfirst into the fiery and, let's be honest, pretty uncomfortable reality of gastroesophageal reflux disease. We're going to break down exactly what is happening inside your body and, more importantly, how science can fix it. If you've ever wondered why certain foods seem to just instantly betray you or why lying down on the couch can suddenly feel so awful, well, you're absolutely in the right place. We're going to map out the causes, the symptoms, the trigger foods, and the scientific treatments that can really help you reclaim your comfort. So, let's start with a totally universal experience. I mean, so many of us have felt that sudden, uncomfortable heat rising up in our chest right after a big meal. But what's actually happening when your stomach's internal security gate just fails and lets all that powerful acid creep back up? Today we aren't just talking about a minor little nuisance. We are talking about a highly specific mechanical failure inside your digestive system. Here's our quick roadmap for today's explainer. First, we'll cover the mechanics of GERD, then recognizing the symptoms, followed by causes and trigger foods, lifestyle and diet changes, and finally, scientific treatments and surgery. Let's get right into it. Starting off with Section 1, the mechanics of GERD, or as it's perfectly described, the plumbing problem. Okay, so think of your body as a highly complex plumbing system. When it works, it's an absolute marvel. But when a valve fails, yeah, you've got a major problem. To really grasp GERD, we have to look at a mechanical failure of a very specific one-way valve called the lower esophageal sphincter, or the LES for short. Usually, when you swallow, this little circular band of muscle at the bottom of your esophagus is supposed to relax, let your food and drink flow into your stomach, and then firmly snap shut. But in gastroesophageal reflux disease, this valve weakens, or it just relaxes when it absolutely shouldn't. Now, you might be wondering, what's the critical difference between normal, occasional acid reflux and the damaging cycle of full-blown GERD? Well, it all comes down to frequency. Having a little bit of acid wash back up once in a blue moon, that's totally normal. But GERD is the constant, repeated backwash. Your esophagus simply isn't designed to handle the highly corrosive acid that your stomach naturally produces. So over time, that constant exposure chronically irritates and inflames the lining of your esophagus. So the absolutely crucial point here is that when this muscular security gate becomes weak, it allows stomach acid to escape upward and just wreak havoc. Imagine a literal gate that slowly swings open in the breeze. That is your weakened LES. It's just letting stomach contents, like acid and sometimes even bile, flow completely backwards right into unprotected tissue. Moving on to Section 2, recognizing the symptoms and looking out for those red flags. So, how do you actually know when that security gate is failing? Well, notice how the upward travel of acid causes this crazy domino effect of physical discomfort. It almost always starts with that classic heartburn, that burning sensation right in the middle of your chest. But as the acid keeps moving upward, it brings a really sour taste to your mouth. It can actually make swallowing difficult, create that super frustrating sensation of having a lump in your throat, and, get this, the acid can even travel high enough to cause bad breath and physically wear down the enamel on your teeth over time. Crazy, right? But the acid doesn't just stop at the esophagus or the mouth. If you're experiencing this at night while you're lying down, it can literally spill over into your airways, causing some pretty severe and totally unexpected symptoms. We're talking about a chronic, ongoing cough that you just can't seem to shake, inflammation of your vocal cords resulting in laryngitis, and even new or worsening asthma symptoms because the acid is actively irritating your lungs. Let's dive into Section 3, causes and trigger foods. Basically, what fuels the fire? While the valve might be physically weak, we often do things that force it open without even realizing it. Let's look at physical pressures first. Conditions like obesity and pregnancy physically push upward against your stomach, which increases intra-abdominal pressure. It's exactly like squeezing a tube of toothpaste from the bottom. You're just forcing that top valve open. Then there's a hiatal hernia, which is an anatomical issue where the top of your stomach literally bulges up through the diaphragm into the chest cavity, totally ruining your internal pressure dynamics. And, of course, if your stomach is just slow to empty out, well, there's simply more material sitting in there waiting to splash back up. Now, diet plays a massive role in holding that security gate open. On one side, we have the usual culprits. Fatty and fried foods delay stomach emptying. Coffee, alcohol, and yes, even chocolate actively relax the LES muscle, practically propping the security gate open for the acid. Tomatoes and citrus add extra acid to what's already a pretty volatile mix in there. But on the flip side, we have the soothers. High-fiber oatmeal is great because it absorbs acid. Natural anti-inflammatories like ginger and super gentle foods like bananas and papaya actively soothe your digestive tract without triggering a heavy acid response.
All right, Section 4, Lifestyle and Diet Changes. Let's talk about calming the fire.
The really great news here is that understanding these mechanics gives you the ultimate power to intervene. By simply removing the pressure, you give that one-way valve a fighting chance to do its job. Eating smaller meals means you just aren't overfilling the tank. Stopping food intake 3 to 4 hours before bed ensures your stomach is actually empty before you lay down for the night. Wearing loose clothing around your waist immediately stops external pressure on your stomach. And quitting smoking is absolutely huge because nicotine is a known relaxant of that LES muscle.
If nighttime is your worst enemy, you really need to remember this number, 10 to 20 centimeters. You've got to elevate the head of your entire bed by this amount, using blocks, bricks, or books under the legs of the bed frame itself. And what's really fascinating here is that you should absolutely not just use extra pillows. Simply propping yourself up on pillows forces your body into this bent shape, which actually increases the pressure on your belly and pushes the acid straight up into your throat.
Because remember, gravity is your absolute best friend when dealing with GERD. That is exactly why lying down flat right after a heavy meal is just a complete mechanical disaster. Without gravity pulling the contents of your stomach downward, a weakened LES offers basically zero resistance, and the acid just freely pools right into your esophagus.
And that brings us to Section 5, Scientific Treatments and Surgery, also known as the medical escalation.
So when lifestyle adjustments aren't quite cutting it, science provides a clear escalation ladder. Step 1 is the pharmacy level. Antacids and alginates give you short-term relief by either neutralizing the acid that's already there or creating a cool little foam barrier on top of your stomach contents. But if that's not enough, doctors can escalate to Step 2, H2 blockers like famotidine or proton pump inhibitors, better known as PPIs, like omeprazole. These don't just neutralize acid. They literally tell your stomach's acid-producing pumps to shut down. This gives your esophagus weeks of relief so it can finally heal. And ultimately, Step 3 is surgical intervention. For those who simply cannot find relief with medication, surgeons can step in and physically rebuild your security gate. In a procedure called a Nissen fundoplication, surgeons take the very top part of your stomach and wrap it completely around the lower esophagus. This physically tightens the sphincter, recreating that one-way valve we talked about and effectively stopping acid reflux dead in its tracks. Now, it's absolutely crucial to understand why doctors take this so seriously. Untreated GERD isn't just an annoyance after dinner. Long-term acid exposure literally burns your esophagus, causing severe inflammation and even bleeding, known as esophagitis. As your body tries desperately to heal that damage, it forms scar tissue that can narrow your food pathway, which is an esophageal stricture, making swallowing an absolute nightmare. And most concerning of all, chronic acid damage can trigger cellular mutations known as Barrett's esophagus, which are precancerous changes to the tissue lining. I really love this quote because it completely empowers us. It validates the very real pain of chronic heartburn while reminding us that we have a highly effective medical toolkit to fix it. Whether it's swapping out that late-night coffee for chamomile tea, elevating your bed frame, taking a targeted PPI, or even exploring surgical options, you absolutely do not have to just live with a burn. So as we wrap up this explainer, I really want you to think about that little security gate inside your chest. Every single time you eat, that valve has a very specific job to do. Knowing what you know now about gravity, physical pressure, and those sneaky trigger foods, ask yourself, how are you going to treat that gate after your next meal?